I want to start today with our guidance for reopening schools. This will be out shortly, although it's my understanding that our web page has been hacked, so some disruption going on, but we'll see. We'll get this out as soon as we can. Over the last few weeks, Lieutenant Governor and I and our team have talked to dozens and dozens of teachers and superintendents, school officials, educators from across Ohio, as well as medical experts. And I just want to say on a personal note that I really enjoyed those conversations. The dedication, the focus of our educators in the state of Ohio is absolutely amazing. They went through a difficult time. They continue in a difficult time. But they've remained focused on our kids, remained focused on doing whatever they can to educate them as this virus continues. Let me just say that we start with some basic principles that I think we all can agree, and they're basic principles behind what we are sending to the schools in Ohio. One is that we have an obligation, all of us, to educate our children and to keep them safe. We recognize that parents are the first and best teachers. We also recognize that there is an obligation that we all have to educate every child in this state, no matter what their background, where they're from, where they live, what their individual circumstances are. Next, a basic principle: local control of our schools. Over 630 some school districts in Ohio, plus many private schools, other schools. The idea that schools are controlled by the local community, by the parents, by school boards that are elected with our public schools is ingrained, I think, in all of us. It's the system we grew up with. It's the system we've had in Ohio for many, many years. The state does have an obligation. The state does have an obligation to do everything we can to make sure no matter where that child is, no matter what school district they live in, they get a good education. So balancing local control, state interest in protecting our kids and making sure our kids get educated. I think there is a strong consensus among teachers, school principals, parents, and the public around Ohio that our kids need to get back into the school building, and that is something that is important, that no matter how hard everyone tried, and they did a good job with very little notice, to educate children outside the classroom without being in a physical building. Some kids, because of their circumstances, their inability to get the internet, whatever, did not get exactly what they should have been getting. So just some general comments. We have developed, working with educators and other health officials, we've developed a set of guidelines backed by science that each school should follow when developing their reopening plans. This approach allows schools to adjust their rules to what works best for them to create a safe environment and one that will protect students and staff from the spread of COVID-19. We know that COVID-19 is mainly spread through contact with an infected person's respiratory droplets that come from sneezing, coughing, yelling, or even talking. And because school buildings are indoor settings, with students and staff in close proximity for an extended period of time, they are prime places for the spread of COVID-19. We know that generally it is important to get kids physically back in school. While teachers and students did an outstanding job of implementing distance learning this spring, The American Academy of Pediatrics strongly recommended that students should be, quote, physically present in school as much as possible. They emphasized that there are major educational, health, and social benefits for keeping most students physically in schools. And so to be able to keep schools open, each of our guidelines is designed to create the safest environment possible for our students and staff. I'd like to spend a few moments now briefly outlining each one, but specific details about guidelines will be made available in the comprehensive document that I just held up, and it will be available when our website is free at coronavirus.ohio.gov. Guideline 1, vigilantly assess symptoms. Now, let me just say that these first guidelines are not going to be a great surprise to anybody. COVID-19 spreads so rapidly, it's essential that students and their caregivers, staff, and volunteers conduct daily health checks prior to going to school that include taking temperatures and assessing for symptoms. Anyone with a temperature above 100 or any COVID-19 symptoms must stay home. If there is a higher risk of COVID in a community, schools can scale up this guidance by taking temperatures of students and staff as they enter the school building, for example. School administrators must send home students and staff if they develop symptoms or a temperature at school, and they must refer them to an appropriate health care provider or a testing site. Further, they must contact their local health department if there is a case of COVID in their school. Since testing is one part of a comprehensive strategy to protect against the spread of COVID-19, schools must work with their local health departments to implement a testing strategy. Let me just say that I've been very pleased as we've talked to health directors, as we've talked to schools, that by and large, from what we can see, that close cooperation is taking place. Guideline 2, again, no surprise, wash and sanitize hands to prevent spread. According to the CDC, hand washing and other common prevention methods are some of the most effective ways to reduce the spread of infectious diseases. Therefore, schools must provide ample opportunity for students and teachers to wash their hands throughout the day. To supplement this, schools must provide hand sanitizer in high-traffic areas, including entrances to the buildings, classrooms, and require its use. Guideline 3. Thoroughly clean and sanitize the school environment to limit spread on shared surfaces. COVID-19 can spread by touching a contaminated surface and then touching your mouth, your nose, or your eyes. According to the CDC, using disinfectants reduces the spread of infectious diseases. And I would say that, although I'm not reading it all the way through this report, there will be places where you can click on and get these guidelines or get these sources of information the way it has been written. Number 4, practice social distancing. We know that social distancing of at least 6 feet can reduce the spread of infectious diseases. The spread is further reduced when other preventing measures are layered on. Schools should strive to maintain 6-foot social distance among students, staff, and volunteers as often as possible in all school environments, including classrooms, hallways, restrooms, cafeterias, playgrounds, drop-offs and pickups, and on school buses. Implementing this guideline will certainly make things look different in every school. And schools are just different. And that's why there's a great deal of flexibility, obviously being allowed, as it should be, for the schools and the people who run the schools to determine how to implement these aspirational goals. Some schools may decide to stagger lunch times. Others may decide that students should eat in their classrooms rather than in the large cafeteria. Other schools may implement modified schedules to reduce crowding. Schools can help encourage social distancing by posting visual cues and reducing large groups mingling. Number 5, face covering policy. Every school should develop and must develop a face covering policy. Scientific studies show that using face coverings can significantly reduce the spread of COVID-19. Let's talk about the staff at first. Just as we have done in the business sector with employees who work in other businesses, other occupations, we are requiring school staff to wear face coverings to reduce the spread of virus unless it is unsafe or when doing so could significantly interfere with the learning process. Again, very similar guidelines, almost word for word, in regard to school and in regard to what we've already put in place with other workers. When face coverings are not practical, face shields may be considered. For example, wearing a face mask could make communication more difficult in some cases when teachers are interacting with students, students maybe with disabilities, maybe younger students, or students who are learning a foreign language. Because of the importance of face masks in slowing the spread of COVID-19, schools must, as I said, establish a face mask policy. In so doing, they should consider all the available science. It is the state's strong recommendation that children third grade and up should wear face masks. Now, I have tried, and I know the Health Department and the Education Department have tried to read about every piece of evidence and information and studies that we can in regard to this. There's clearly a strong consensus among health and children's experts that children 6th grade and up should wear face masks unless there's a medical or developmental reason for that child not to do so. And I want to emphasize, because I've heard from different parents about this whose children cannot wear a face mask. The school should work to reduce and do everything in their power to reduce any kind of social stigma for a student who, for medical, developmental reasons, cannot and should not wear a mask. So our recommendation is 3rd grade and up, strong recommendation. Again, we ask the schools to look at the science and develop a policy. They should look to the best science in developing a face mask policy. I would imagine that some schools will be comfortable in starting masks in kindergarten, some 1st grade, some later. The majority opinion, as far as we can tell, among experts, appears to be that children kindergarten through 5th grade can wear masks as long as allowance is given for the age and developmental level of that child and the physical situation that the child is in at that particular moment. That's a long way of saying we just use common sense. We follow the science, we use common sense in regard to how it gets implemented. We wear face masks to protect each other, often because people are sick, but people show no symptoms. Masks can be especially useful and are strongly recommended at any grade level during periods of increased risk when physical distancing is difficult. And obviously, when someone is on a bus, schools are going to have, and I'll talk in a moment about buses, but schools are just going to have an inherent problem in regard to buses. So, certainly riding the bus, picking up meals, families, schools, and students should use as much as possible the face mask to decrease the spread of this virus. To assist the schools in our efforts to implement our 5 guidelines, the Ohio Department of Education has created a document. Again, I held it up. The Reset and Restart Education Planning Guide for Ohio Schools and Districts. So actually, there are 2 separate documents. One is the more educational document. The one is the more health. They can bring them together, and both should be looked at. The latter one, which I'm talking about, is designed to help teachers, principals, and administrators think through solutions to the many challenges that they face. The document provides resources, information for community decision makers as they contemplate how to reopen safely. We are mindful that in order to reopen schools safely, there are many unforeseen expenses, and some that are already very much foreseen, I know, as talking to superintendents, that will now find themselves, the schools, responsible for. Buying sanitizer, making alterations. That's why I intend to work with the General Assembly, with the 4 leaders, to come up with a plan to give schools some assistance and, frankly, to take some money from the CARES Act dollars. Again, that is something we are in discussion with the members of the General Assembly. I talked to the Speaker this morning and the Senate President, Mr. Householder, Mr. Obhoff, and those conversations are going to go on with the minority leaders as well. And again, we hope within the week to announce specific money that will be going to the schools. We do not anticipate it's going to be enough necessarily to take care of all the things that are taking place and that schools are doing. But we want to make sure that schools know that this money is in fact coming. I want to specifically thank, and again, as I said, a lot of conversations that John, you and I both had, most of them separate, and John would report to me many of them that I had with superintendents all over the state. You know, men and women who are just doing a phenomenal job, with teachers all over the state, with some principals, with parents. And that input has been exceedingly helpful. And I think it gives you, if you could have been on those calls, you would have had a great deal of confidence about what's going on in regard to education in Ohio. We face challenges, but we got a lot of great people out there who are just doing some amazing things. Specifically, I want to thank Buckeye Association of School Administrators, the Ohio Association of Public School Employees, the Ohio Education Association, the Ohio Federation of Teachers, Ohio School Board Association, Ohio Association of School Business Officials, the Alliance for High Quality Education, the Ohio Association of Career Tech Education. And again, with Career Tech, some of our most interesting conversations always occur, and we're talking to our friends in Career Tech because they're doing things that are different, and they face particular challenges in trying to do things that need to be hands-on, and sometimes, you know, this past school year they were not able to do that. I'd like to thank the many individual superintendents, school leaders, public and private, who contributed, and parents across the state who submitted thoughts to the Ohio Department of Education. So many of that came in, and many of you sent ideas into my email or texted it to me. Our guidelines are based on the best scientific evidence and data we have. What we will point out, and one of the reasons that when you pick up this document, and you open it up, you're going to see a lot of places where you flip for additional information. This is sometimes the CDC. It may be other sources. So as data, more comes in, more information comes in. As we learn more about this virus, it is good to continue to try to keep up, and that's why we have this as really an interactive process.